I'm Rhett Hallows from Duke University, and I'm going to go through RI Hip Modeler live workflow. First thing we're going to do here is we're just going to search for our patient name, and this patient is going to be named ABC. So we search, we see this come up. We're just going to click on it, make sure we have the films that we need to do to proceed, which we do. And so once you see everything you need here, we're going to go up, hit the arrows, move to the next slide. Before it will let you proceed, you're going to have to pick the side that you're going to be operating on, and we'll just pick the right side. We're going to pull our films through Quentry. So if we search the little cloud, the cloud is going to be our Quentry database, and here's our films for our patient. And so if we just click on the film, it's going to show the film, and we're going to have to pick which one this is. So this is a sitting film, so we'll just click on the sitting. It's going to bring us back to the previous screen. We're going to click on the other film, which is our standing. So we'll click our standing film. We're going to save that. And then once we go here, we're just going to keep working through the workflow. So next arrow. It's just going to give you a warning screen about things that you need to look for and make sure you can see clearly before we move forward. So we'll just hit OK. And so as you can see here, we have the standing and the sitting lateral radiographs. And so we'll start on the standing film, and the first dot, the number 1, you're going to want to put on the end plate of S1. So we're just going to allows you to zoom in. So my pointer's close to S1, and then above that is going to be a zoomed in screen, so you can accurately place that one. The second one, we're going to go with the inferior end plate of S1. So once again, we're just going to find that. We can kind of come down, zoom in really nicely, and put it right on there. Second points we're going to look at are the pubic symphysis and ASIS, and we'll start up at the top at A. Now this is going to be your ASIS, and you're going to want to identify both sides of the ASIS. So this is one side of the ASIS. This is the other side. You're going to want to put a point somewhere in between, right in the middle of between those two. So if this is one, there's the other one. We're going to put that right in the middle. The second one you want to put center of the pubic symphysis. It's going to be there. And that gives us our standing sacral slope. And now we're going to come over to our sitting film. We're going to do the same thing here. We're going to find our end plate, S1 end plate. We're going to put that one there. We're going to come and do that same mark, the inferior end plate here. Let's just make sure we got that good. And so from there, gives us a few numbers. It's going to give us our standing and our sitting sacral slope. It's going to tell us what the change is, which is 4. And based on the categories, this is considered a fused spine, which you might expect to see with somebody with spinal hardware in place. We're just going to save that. And then from there, we go to the next screen. So here, what this is going to show us is we're going to go through, and you can pick if you want. You probably have preoperative templated this, and so you're going to go in and put the implants that you've templated for here. Just do our drop-down menus, R3 neutral liner. We'll just go with a 32 head ball. We'll start with the 0 and start with the standard polar stem. And what that's going to do, just going to kind of set this at a general spot, 40-15 with 15 degrees of stem anaversion. It's going to show you a plot, an implant impingement plot, as well as an activity circle. And from there, you can actually gain a lot of information. The first thing we want to do is we're going to want to set this to functional plane. On the functional plane, next step usually is just, if we look at our activities of daily living and our impingement zones, we want to try to get that as best possible. So you're going to hit the auto center button, which is going to try to minimize our impingement zones through all activities of daily living. And then that's going, so you can see that sets your cup inclination and aversion based on best modeling here. If you wanted to compare we could go in and put something different, and we'll see down in the screen down here. And let's just go with a bigger head. Actually, let's do this just for the sake of just to see the differences. And you can see now we have two different models set. Blue is going to be the blue ring, pink is going to be the pink ring. And you can see those two different zones on the activities. You can see it. If we click on one of the activities, it's going to break that down for us. You're going to see the motion over in this panel over here. You're going to see the motion of the femur up in this box up here, and down in the implant impingement, you're going to see that motion represented here. And you can see how close this person comes with a stiff spine, or a fused spine, sorry, how close they come to implant impingement. And if we really wanted to make this so we can see things, let's just take our liner and add in a lipped liner. And you can see in this version of this, and if we click this and go back, this model is going to show you in the activities, if it's red, that in those red portions you're getting implant to implant impingement. And so if you see that, you're going to want to change, obviously, something about your implants at that point in time to try to minimize that. You can change your implants. You could also, if you needed to, start to change the cup inclination and aversion slightly to see if you can change that. So if we just go back to let's just go back to our original plan now, which is this. We've auto-centered it, which gives us the best version of where our cup should be based on this person's fused spine. And then from there, if we're talking about hip navigation, once we've set our functional plane where our cup needs to be, we're happy with our activities of daily living, no impingement. The next thing you're going to do is you're going to switch this to the anatomic pelvic plane. Slightly different referencing zone, but now this is what we're going to take from the hip modeler into RI hip navigation, and those numbers are going to be your goal when you're navigating your cup with the navigation system. So once you're happy on this screen, we'll just come up here. We're going to go to the next screen, which gives you a summary page of everything that we've just done. Up in the top corner up here, it's going to tell you what your implants are. R3 with a neutral liner, 28 head, 0 neck. It shows us that we're referenced to our anterior pelvic plane. It shows us what our stem version is and the inclination and aversion of our cup, goal of our cup position. We can see down here in this box that it gives us some variations in femoral anaversion. 15 is set as a standard, but if you feel like there's a slight change, it gives you different options of where your cup can be placed if you feel like there's slightly less or slightly more anaversion. Up in this box up here, it shows you your panels of where you'd set your slope and your pelvic referencing. It once again shows you your sacral slope change, which defined as a fused spinal pelvic mobility with 0 pelvic tilt for this patient. And then it comes down and shows you this implant and activities of daily living graph once again. And this is what will get taken into the RI hip navigation system if we upload it to Quentry. So once you're happy, once again, here we've got all this information. We're going to upload into Quentry, into our patient's data. We've succeeded in saving it. And from there, that is the end of the modeler. And we can go find that once we get into RI hip navigation intraoperatively and pull this screen up to reference when we're navigating our total hip arthroplasty.